This poster has been presented at the 6th World Congress on Itch held in Brest, France. Itch occurs in various patient populations. A direct comparison of the experience of itching across the different populations is lacking. However, it would be interesting to know what the magnitude is of the itch problem in these different populations. The aim of the present study was therefore to investigate the profile of the itch experience in patients with different skin diseases. We conducted a cross-sectional studies in patients with atopic dermatitis, chronic urticaria or burns. Patients could be included if they were 18 years or older, Dutch-speaking and literate, mentally and physically capable of filling out the questionnaires, and if they provided written informed consent. We have included 63 patients with atopic dermatitis, 41 with chronic urticaria, and 46 with burns. Itch in this study was measured using the Leuven Itch Scale. With respect to the prevalence of itch, we found that patients with atopic dermatitis had the highest prevalence, followed by patients with chronic urticaria. 96.8% and 95% of these patients experienced itch respectively. In patients with burns, the prevalence of itch was 55.6%. If we have a closer look at the profile of itch, and more specifically if we have a look at the itch frequency, itch duration, severity, distress and consequences, we see that consistently patients with atopic dermatitis indicated in blue are scoring higher compared to those patients having chronic urticaria or burns. This suggests that the experience of itch in the different dimensions is much more pronounced in patients with atopic dermatitis. In conclusion, the prevalence of itch in patients with atopic dermatitis or chronic urticaria was substantially higher than that in patients with burns. For the frequency, severity, distress and consequences of itch, a significant difference was found among the groups. Although the prevalence of itch can be the same, the profile of the itch experience is different, and this advocates the need for a comprehensive evaluation for which the Leuven Itch Scale could be used. For your information, we are currently developing a tablet PC application for the Leuven Itch Scale. This will allow researchers and clinicians to easily use the instrument in day-to-day practice and in research.